Okay, let's just dive right into this. Welcome back, everyone, to today's Daily Coding Explainer. I'm your host, and today we're basically acting as medical coding detectives. We've got a really fantastic, highly focused case to crack, the classic Aortic Catheter Coding Challenge. Now, I know vascular coding can kind of feel like a giant maze sometimes, right? But if we just focus on the specific words in our documentation and break them down conceptually, we're going to navigate straight to the right code literally every single time.
So, here is the exact clinical situation we need to code today. A catheter placed in the aorta that is not maneuvered into any other vessel. Okay, that crucial point is right there, flashing in capital letters, not maneuvered. You know, as a coder, you really want to train your eyes to catch these negative qualifiers right off the bat. The fact that this catheter just stays put in the aorta and doesn't go anywhere else, that is absolutely the single most important clue to solving this whole case.
All right, so we've got 4 suspects in our lineup. Option A, 36215. Option B, 36245. Option C, 36200. And option D, 36140. Now, I want you to play along here for a second. Think back to that crucial detail we just talked about, the fact that the catheter is placed in the aorta and absolutely not maneuvered any further into other vessels. Which one of these would you pick? Take a quick mental note and lock it in.
Actually, real quick, while you finalize your choice, I have a tiny favor to ask. If you're finding this breakdown helpful and you enjoy mastering these tricky concepts, go ahead and hit that like button on this explainer, and definitely make sure to subscribe to my YouTube channel. I post daily updates and coding explainers exactly like this one, taking these complex scenarios and breaking them down into super clear, bite-sized concepts. Honestly, subscribing is just the best way to make sure you never miss out on sharpening your daily coding skills. Okay, back to the case.
All right, the suspense is killing me. Let's reveal the culprit. If you went with option C, you totally nailed it. The correct code is 36200. Give yourself a massive pat on the back if you got that one right. But hey, you know how these explainers work? Getting the right answer is really only half the battle, right? We need to fully understand the underlying logic so we can actually apply it to future cases.
So the core rationale behind code 362000 is actually pretty fascinating. Let's unpack the official definition we pulled directly from the source material. It says code 362000 is assigned when a catheter is maneuvered into the aorta from any access, but wait, with one major exception carefully tucked into parentheses, other than translumbar. And, exactly as our question stated earlier, it is not further advanced into selective vessels. So basically, we have 2 massive conditions we have to satisfy here. First, it's non-selective, meaning it just stops right there in the aorta. And second, the access point is huge. If the approach was translumbar, entering through the lower back, this code just gets completely thrown out the window because that is a totally different surgical pathway. It literally has to be from any access point other than translumbar for 362000 to work.
Now, to help build out your broader mental map of vascular coding, the source material gives us this fantastic piece of comparative logic. Think of it like a mirror. Code 36200 is the arterial equivalent of the non-selective vena cava code, 36010. Grouping these 2 together is honestly such an incredible learning hack. When you think of the aorta, you're on the arterial side, right? And you use 36200 for that non-selective placement. But then, when you flip over to the venous side, specifically placing a catheter non-selectively into the vena cava, your equivalent code is 36010. By linking these 2 mirroring concepts in your brain, it becomes so much easier to remember the mechanics for both.
And that brings us to our final big takeaway for today's challenge. Are you actually checking for translumbar access before you code? It is just so incredibly easy to see the word aorta, see that it wasn't maneuvered further, and instantly jump to code 36200. But as we literally just learned from the source rationale, you absolutely must verify that access route. If it's a translumbar approach, 36200 is just fundamentally incorrect. So I have to ask, the next time you're staring down an aortic catheterization report, are you going to remember to ask yourself this question before you finalize your code? Don't let that one tiny parenthetical detail trip you up. Keep your eyes peeled, stay sharp, and I will catch you in the next explainer.